Your shoulder pain isn't random, and it's not just getting older. There are specific changes happening inside your joint that most people miss until it's too late. Here's what's really going on and what you can still control. Hey there, I'm Dr. Daniel Orcutt, an orthopedic surgeon who's performed and helped over 1,000 patients recover from shoulder surgery. If you're dealing with pain, prepping for surgery, or recovering, I'll break it all down so it actually makes sense. No fluff, no scare tactics, just real expert advice to help you heal smarter. Let's get into it. Can I ask, have you ever woken up and noticed your shoulder aches more than usual even though you didn't do anything strenuous? Let me know in the comments. We're in this together. Today's deeper dive will help you see what's hiding beneath that ache or weakness. By the end of this video, you'll understand exactly what's changing inside your shoulder and why you still have options. Let me tell you about Mrs. Patterson, a patient in her early 60s. She thought her shoulder ache was just getting old. No heavy lifting, no falls, just nagging discomfort. But an MRI showed a partial rotator cuff tear that had been silently worsening for years. By the time she felt it, the tear was halfway through the tendon. She began PT immediately, rebuilt her strength, and avoided surgery altogether. That is early detection in action. Shoulders aren't simple hinges. They're ball and socket marvels, supported by cartilage, fluid, ligaments, and the rotator cuff muscle. After age 50, all those structures start to subtly shift, sometimes without symptoms for years. Let's start with rotator cuff degeneration. Studies show that about 13% of people in their 50s already have tears, and this climbs to nearly 50% by age 80, even if they're pain-free. That means many people have structural damage before they feel anything. It's not just age, it's wear and tear, blood supply losses, and decreased elasticity. These are called degenerative tears. They develop slowly as tendons fray, cartilage thins, and joint fluid dries up. But here's the kicker. 2/3 of tears are asymptomatic. You wouldn't know they're there. Sometimes never causing symptoms, but sometimes they do. Are you getting ready for surgery? Sign up for our free shoulder pre-op checklist. Click on the link below for the checklist. Normally, the rotator cuff holds the ball in the socket. Once it gives, you lose strength and stability even before pain shows up. And that sets the stage for other shoulder issues. One common outcome, shoulder impingement. As space narrows under the acromion, things get pinched. You end up with fraying tendons and bursitis. Symptoms are pain reaching overhead, pain at night, and stiffening. Exactly the kinds of things many 50-somethings shrug off as normal aging. When you lift your arm, that space under the acromion narrows. If tendons are frayed or swollen, they get compressed. Every reach overhead becomes a cringe moment. And the worst time? At night, rolling onto your shoulder can literally yelp you awake. That's not just aging, that's impingement, and it can be improved even without surgery. What else is hiding? Cartilage wear and osteoarthritis. Cartilage thins, you get friction, and the joint makes noise or grinds. Plus, the joints can form spurs, compressing soft tissues even more. Plus, tendons can calcify, creating calcific tendinitis. That's when calcium deposits build up in tendons, often creating stiffness within the tendon and blasting you with sudden pain, especially at night. Now let me walk you through how calcific tendinitis might feel. One day you wake up with a sharp stabbing pain when you move your arm across your body. Even combing your hair hurts. You can't lie on your side, and heat or ice barely helps. That's usually caused by calcium deposits flaring up inside the tendon. We can target that with focused treatments like ultrasound-guided needling or shockwave therapy, so you don't just wait it out. Treatment can dramatically reduce pain in days, not months. If you found this video helpful so far, tap like and subscribe and share your experiences below. I want to hear your story. Even if your shoulder seems fine, these micro changes are accumulating, weakening support and setting you up for injury. Then there's frozen shoulder or adhesive capsulitis, common in the 50 to 60s age group. The capsule thickens and stiffens and you lose motion fast. This one's especially cruel. It locks you into limited motion and pain and can last months or even years, even after surgery. Frozen shoulder is a different beast. It starts slowly, but within weeks your range of motion drops. You'll struggle to lift your arm, reach behind your back, or even put on a seatbelt. It progresses in 3 phases: freezing, frozen, and thawing. And yes, most recover fully, but it can take 1 to 3 years. That sounds brutal, but with targeted stretching and mobilization, you're rewiring those tight tissues. It doesn't have to be a drawn-out curse. Now you might ask, so what can I do? Is prevention possible? Absolutely. Early detection matters. If you have achiness or weakness, get a physical exam to evaluate strength, rotation, and impingement signs. The doctor may suggest imaging as well. Even asymptomatic tears often benefit from early PT to strengthen supporting muscles and maintain motion. Physical therapy is your first defense to improve biomechanics, rebuild muscle, and delay or avoid tears or surgery. Let's pause and walk through a sample shoulder-friendly daily routine. Make sure you check with your doctor before starting any new routine. Morning, 5 minutes of pendulum swings and gentle range of motion. Midday, simple resistance band rows or scapular squeezes, 2 sets of 15 reps. Evening, doorway chest stretch and gentle sleeper stretches for about 2 minutes. Doing this consistently, even on feeling fine days, keeps those micro changes from snowballing. Bonus tip, stay hydrated. Joints rely on synovial fluid, and water intake influences that fluid volume. Dehydrated tissues are stiffer, less pliable, and more prone to micro tears. Regular movement matters too. Staying active doesn't speed degeneration. In fact, inactivity does worse. Gentle resistance exercises, stretching, and maintaining range of motion keep joints nourished. Lifestyle tweaks matter. Good nutrition, managing inflammation, avoiding repetitive overhead stress, and keeping a healthy weight all help. Now here's something most people overlook: posture. When we slouch, working at a desk, scrolling on our phones, it shifts the shoulder forward. That compresses the rotator cuff space and irritates tendons over time. One of the easiest fixes? Check your setup. Are your shoulders rounded while you sit? Try adjusting your chair height, pulling your shoulders gently back, and setting a reminder every hour to reset your posture. Even small changes, like using a lumbar support pillow or raising your monitor, can relieve strain on the shoulder joint throughout the day. Prevention isn't just about exercise, it's about how you live hour to hour. Check this out. If you're prepping for surgery or hoping to dodge it, sign up for our free shoulder pre-op checklist. And once surgery is on the table, grab our post-op shoulder journal PDF to guide the recovery process, track progress, and keep you motivated. Click on the links below for the checklist and the journal. Let's say you hit the point where surgery is needed, like a large tear, grinding bone, or frozen shoulder that doesn't respond to PT. Arthroscopic surgery can repair tendons or remove bone spurs, and recovery protocols are clear: sling, passive motion, then guided PT. Recovery can take 6 to 12 months, and most people recover about half function by 3 months. But don't let the timeline discourage you. Reinforcement, consistency, and patience are your allies. And if surgery isn't ideal, maybe because of poor tissue quality or comorbidities, you can still rebuild with adapted therapy and non-surgical supports. Here's the reality check. No one escapes biological aging, but letting it define your shoulder health is optional. Modern protocols, early recognition, and smart rehab can help you regain confidence, return to living fully, and maybe even prevent surgery. Challenge outdated thinking that nothing can be done after 50. That's nonsense. More is possible than you've been told. Your shoulders are a story. You're not relegated to the passive pages. You can rewrite the script with movement, consistency, and patience. There's no shame in weakness or swelling. It's biology, but helplessness is optional. If you found the tips helpful, tap like and subscribe and share your experiences below. I want to hear your story.